sort of labeling and because you know, at the end of the day, if you've got mental, you know, if you've got cancer, you get casseroles, but if you've got mental health, you get cricket. So yeah, it's
yeah. Yeah. It was interesting actually, because I was looking up, I have the same issue about diagnoses, and people often come to me and they go, you know, I've got this diagnosis, you know, for mental health. And I'm like, it sounds terrible. It's not that I don't care, but it doesn't matter what your diagnosis is. What matters to me is what your symptoms are and how we're going to work around that. Like, what do you want? What do you want? What symptoms do you want less of? Or, you know, what do we want to improve? And I was looking at the DSM. So the DSM is the Diagnostic Statistical Manual of Psychiatric Disorders. And I don't know when it first came out, but we're now up to volume 5. And there's something like 300 different psychiatric diagnoses in there now. And I'm like, you know, you can have one person that's had like 5 different diagnoses, because every psychiatrist that they see will ask different questions, get different information, and give them a different diagnosis. They'll go and see another psychiatrist. You can have 2 psychiatrists in the same room interviewing the person, and they will both come out with a different diagnosis. It's an art, it's not a science. And so I don't know how we can encourage others to think about themselves as whole people with, you know, something that they want to improve on, for example, rather than a label. Because I so often get people saying, well, I'm ADHD. And I'm like, well, you might have some symptoms that suggest, you know, but that's not who you are. You're not ADHD. You know, that's not who you are. So I don't know what we can do about that, but I totally agree. I think that we're so over-labeled. And I don't want to say, you know, I'm depressed. You can call yourself if you are depressed, but to have that label, and then when are you not that label? You know, it's like, is this good for us to be walking around with these labels all the time? It helps us in communicating and understanding in some ways, but I think it can be really detrimental, actually.